I'm Dr. Kelly Starrett, co-founder of the Ready State and human performance advisor for H-Wave. Today we're talking about how to use the H-Wave to decongest a painful elbow. Now, when we're talking about feeling better, ultimately we're trying to get rid of pain as our first order of magnitude goal, which means, can I change some aspect of the local tissue physiology to maybe reduce swelling or congestion area that may be contributing or sensitizing this tissue? Now, most of the time when we have pain around the elbow, it's either on the inside near the bone or on the outside near the bone. Now, what's confusing potentially about using an H-wave to create a non-fatiguing muscle contraction is that I may not be directly on one of those painful spots. In fact, a solid muscle contraction on that spot may not be something that I want because it's noxious, it feels uncomfortable. So what I've done here is I've set up a couple pads, one lead below the joint I'm trying to work on and one lead above the joint. Now, all the joints in your body are drained through the deep lymphatic system, which means that if I have any swelling in a joint or around the area of the joint, that's all cleared through the lymphatics or the sewage system of the body, which is driven by muscle contraction. And one of the reasons we see sometimes insidious sort of elbow problems is that as my arm hangs by my side all day long, I'm not potentially getting lots and lots of movement in the forearm, in the biceps and triceps to kind of pump out and continue to move that waste out of the system. So what's amazing about having the H-wave here is that it allows me to get a non-fatiguing muscle contraction that I can fall asleep with, or I can get little doses through the day to help facilitate this decongestion and swelling management. What's nice then is oftentimes when we manage swelling more effectively, even though I may not have changed the original injury or sort of tissue trauma that has sort of set the bell ringing, by improving the local tissue physiology, I oftentimes can feel less congestion and thereby experience less pain. Now, what's happened here is if I always have a choice of going above and below, I should do that. And I don't need to be so particular about my pad placement or which muscle I'm contracting, because remember, the whole thing is going to come out and drain out through the arm. So any muscle contraction in the limb is going to be effective. So what I'm going to do here is turn on the device, and I've already got my pads placed, and I just kind of threw them on here, on a flexor compartment, on my extensor compartment, on my biceps and on my triceps. I'm going to select low frequency on both, and then I'm just going to set this up till I get a comfortable muscle contraction. Now you can see that I could absolutely just kind of override this if I needed to move something and then hang out, which means that I could be reading emails or working, and then when I needed to type, and then when I needed to just decongest, I could decongest. If I add in a little bit of the upper body, above the elbow, biceps and triceps, you see that if I go crazy here, it's going to feel like I couldn't really get much done in my life. But what's nice about this is I can find any muscle contraction, and I can really do a lot to drain this limb and create a situation where I'm managing potential congestion, contributing to my pain, or rate limiting my healing. Now, if I'm not feeling like I'm getting a good enough contraction, I can always move the pads around until I get something that's more comfortable, or until I feel like I'm getting a more significant contraction. So now you can see that I'm actually contracting on a tissue that maybe I was targeting and something else. But keep in mind, pad placement is secondary to making sure I get a good contraction in the system. Also notice is that if I can find a position where I can really relax the arm, I get a much stronger contraction. If I'm sort of kind of tense or working or have to hold my arm up, my own brain is going to override that, and I'm just going to be holding some tension there. So placement of the limb, or just sort of organizing the limb, means that I'm going to get a better contraction through the limb. But the bottom line is, can I get some movement in this tissue? And if I can do that, what we often find is less pain and faster recovery. So we like to say around here, you either heal at the rate of a human being or you don't. So use the H-wave to help facilitate flushing, blood flow, and decongestion. Bring the groceries in and get the garbage out, and see how much better you can feel.